Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us once again for our weekly press conference on Delaware's response to COVID-19. We have our daily presentation, as we do every week. We have conversations with Dr. Carol Rattay, who's the Director of the Division of Public Health, who's joining us once again. We appreciate the tremendous work of her team. Hopefully we're moving into a new phase here, which we'll talk about. We've got AJ Shaw, who's the Director of Delaware Emergency Management Agency and has been a point person working with all of our partners on both testing and vaccinations. And we are clearly moving into a new territory with respect to both of those undertakings. So we did, and we also have Pam, who's our sign language expert. Pam, thanks for joining us again for the deaf and hard of hearing. It's been an interesting week. We've been from the beginning. Our watchword has been to follow the science, to take the recommendations from the Centers for Disease Control, the White House Task Force, the National Institutes of Health, and all the public health experts, and translate it with a little dose of common sense and the situation on the ground and data here in the state of Delaware to come up with policies and procedures and emergency declarations that reflect that science and the guidance we're getting from the CDC that reflect our abilities here on the ground with our teammates and partners with the hospitals, the physician community, first responders, Army and Air National Guard. And we've learned a lot. It's been an interesting year plus now with the first cases that we saw back in March of 2020 coming out of a meeting among university professors and graduate students in Princeton, New Jersey. And we've learned a lot as we rode that roller coaster ride up into late March and April with the increase in number of cases, with the positive cases, so with the number of hospitalizations that went up. We'll talk about that in a minute. Then down the other side of that initial peak after we closed down through emergency orders, various sectors of our economy. Back at the beginning, there was not conclusive recommendation from the CDC around mask wearing. Gradually over the last year, we've learned that wearing a mask has been the most important thing that folks could do because that the virus was transmitted through respiratory particles that are emitted when you speak, sing, cough, sneeze. And that's why it's recommended that people cover their mask when they cough, wear a mask in all cases, really to protect others in case you're COVID-19 positive. Well, I guess over a week ago, we did get information, good, positive information from the Centers for Disease Control that the vaccines are really working and that they're protecting those who are vaccinated. And therefore, that people that are vaccinated, it's not necessary for them to wear masks either indoors or outdoors. But those that are not vaccinated are still at risk and should wear a mask. Well, the translation of that into actual enforcement and policy at the state level has been confusing for all the governors. We had our White House Task Force meeting and conversation this morning, and each state has responded a little bit differently. We will recommend, and Dr. Rattay will talk about it, following the CDC guidelines as we have from the beginning, recognizing that there are challenges with respect to mostly enforcement because you don't know who's vaccinated and who's not. And we're not going to be in the business of asking people or for the so-called vaccine passport so you know who's vaccinated and who's not. However, at the same time, as an employer, we will require everybody wear a mask when they're in a public building. If you're a state employee, unless you're at your desk and it's safely socially distanced, et cetera. And I know we'll be working with a lot of employers trying to figure that out for their individual establishments, particularly retail establishments. I know when I go into my Wawa every morning, I'm going to wear my mask just so it's clear that that's a place that's safe, and frankly, not to stigmatize those folks who who aren't vaccinated. I am fully vaccinated and wearing masks. So it's going to be a challenging time. It's good news though. And the bottom line is we really got to lean into getting everybody vaccinated. If we get everybody vaccinated, it's not a problem. Right now, we got about 50% who are vaccinated roughly and about 50% who aren't vaccinated. Overwhelmingly, and we'll see this in a minute, our most vulnerable populations, those folks, adults 65 and older, are pretty fully vaccinated, kind of north of 90%. And so they're protected from serious disease, from hospitalization, and from death. Although there are some breakthrough cases for sure, and that's a reason, frankly, to be cautious and maybe wear a mask voluntarily. But we also know that the population, young adult population, that has been kind of the source of some of this spread over the last several months is only vaccinated at about 25%. So 75% of that population is still unprotected with these very important and effective vaccines. So we really got to lean into getting as many people as we can vaccinated so that everybody has the protection that the CDC came out with this week in saying that those folks that are vaccinated don't have to wear a mask. And so you'll hear more about this than the specifics with Dr. Rattay. Good luck, Dr. Rattay, in explaining all that. There are many exceptions, by the way, which the CDC wasn't very clear about when they made these pronouncements, but we'll work through it. We're in a good place. Let's look at the data here. Things are getting better every day. New cases, we're down to 120 on a 7-day moving average, hurtling downward to fewer than 100. Again, positive tests down below 5% at 3.7%. Again, moving in the right direction downward, in part because we have about over 50% of eligible Delawareans who are vaccinated, and that's an important consideration. Down to 77 hospitalizations, really critically important. And sadly, still 1,600, over 1,651 lives that are lost. But again, that has really flattened out with many days where we do not lose anyone. So let's look at the roller coaster ride over the last year plus. You can see the run up in positive cases, and this is a graph of hospitalizations that takes us back to the initial data in April, late April. You can see the peak there in late April and early May. Rode down the other side into late May, and as we opened into June, as we opened up again after having been shut down in the spring and in May for the summer months, which were pretty safe in terms of hospitalizations. We hit a low of 29 in the hospitals on August the 16th, as you can see there. The initial peak was 337 hospitalizations the last week in April. And then, of course, we had this second roller coaster ride and peak after the December holidays, after Thanksgiving and beyond. We peaked out there in early January the 12th at 474 hospitalizations. So a peak that was higher than what we had experienced in the spring. At that period in time, we had started to vaccinate Delawareans. And you can see the decline on the other side of the peak until March 11th, where we hit 83. And then again, even though we had vaccinated at that point about 20% of the population with at least one vaccine, another kind of mini surge there, and a peaking of 180 Delawareans in the hospital on April the 21st. Again, several months into our vaccination enterprise. And so you can see, notwithstanding the fact that people are getting vaccinated, people are also getting COVID-19. They're requiring hospitalization, and some few even are passing away. Currently, on May the 17th, which was yesterday, we have 77 in the hospital. So it's been a roller coaster ride up the slope there in April of last year, down the slope on the other side to June and through the summer, then up again, a large peak and late December and January, and then a little rise again on April the 21st with 180. But we are making tremendous progress in vaccinating Delawareans. So far, almost 850,000 vaccines have been administered across our state, and we'll see in a minute how we're doing in terms of the vaccine rates in the 3 different counties. Fully vaccinated, about 353,000, and we need to push that number up. What does that represent? About 90%, as I mentioned before, of Delawareans who are in the most vulnerable group. So age 65 and older, these were the first group eligible too, by the way, have received at least 1 dose, and it's a very high percentage of those in the 80% that have been fully vaccinated. So that most vulnerable population is overwhelmingly protective with very effective vaccines. Not so much for the rest of Delawareans. 63% of Delawareans, of adult Delawareans 18 and over, have received at least 1 dose. So some percentage of those are not fully vaccinated, but 63% is a good, strong number. We want to get up to 70%, and we want to include in that denominator the younger teenagers and children that are now eligible to be vaccinated. So here's the breakdown. How we doing in terms of vaccination rates in each of the 3 counties? Sussex County is leading the way, continues to lead the way. Part of that may be a function that there are a senior population there in Sussex County with the retirees to the beautiful part of our state have been vaccinated at a high rate, but over 60% of Sussex Countyans have received at least 1 dose, 16 and over. So all adults 16 and over. Newcastle County, 57.5%. That's an increase from what we saw, I think, last week, and then bringing up the rear and really needs some work to go in Kent County, where more than half of the people have not received 1 dose. And so if you think about where we're headed, where we're not going to require people who've been fully vaccinated to wear a mask, and they don't have to because they're not transmitting the disease and they're not susceptible to it. There are exceptions to that. But the unvaccinated part of the community, more than 50% here in Kent County, should be thinking about wearing a mask voluntarily so that we don't have an outbreak there. The next slide, if your bottom line is, if you're fully vaccinated, you have significant protection from COVID-19 infection and serious illness. You're also less likely to give the virus, if you have a case of it, to someone else. But those who are not vaccinated are still at risk of getting the disease and of hospitalization, et cetera. So bottom line, let's get everybody vaccinated. That's where we end up. Effective May 21st, no capacity restrictions indoors. We've talked about that. Well, none of this is really new. Wear a mask if you're not fully vaccinated. Wear a mask if you're not fully vaccinated. Wear a mask if you're not fully vaccinated, and you can get your vaccine at de.gov/getmyvaccine. We would encourage everybody. We want to get up to 70%. That's the national goal. That's going to be our goal. We need your help in getting there. Dr. Calrate, why don't you get into some of the specifics there and talk about where we are, some good news, and then some challenges as we look to the future.
Great. Thank you so much, Governor. So as always, I'll start with areas of concerns. As the governor mentioned, we continue to see reduced case rates and numbers, as well as positivity rates. So we like the look of this slide. There's only one area of concern based on the same criteria that gave us 26 areas of concern about a month ago. You may recall last week, we only had one, which was Frankfurt. This week, we moved to the other end of the state, to Delaware City. Delaware's case rate, though, has decreased 29% since last week, and the positivity rate has decreased except for Sussex County. This may be due to a decrease in testing, but overall, the numbers look good. Hospitalization and death rates have decreased. Hispanics have the highest case rates in Newcastle and Kent County, while non-Hispanic Blacks have the highest rate in Sussex County. But again, overall, those numbers look good. But let's take a look at the variants. So our weekly look at the variant level in Delaware still shows a high level of variants in circulation, though fewer identified last week than the week before. So of the samples that are sequenced in our lab for surveillance last week, 57% turned out to be variant strains compared to 61% the week before. So even as case levels do come down, we do need to be aware that more of the virus versions that are circulating in Delaware are predominantly the more virulent ones, these variants, in comparison to the wild type virus that we had for mostly the first year. And why, again, this is important is that these variants tend to be either more contagious or have more serious consequences. We're also keeping an eye out for other variants like the India variant, which is another concerning variant. And I think that this really underscores an important point. Things are getting better, but COVID has not gone away. Getting tested if you develop symptoms, whether you are fully vaccinated or not, still is vitally important. And more important if you are not vaccinated and either have symptoms or have had exposures to other unvaccinated people. Protecting yourself and your family against the effects of these variant strains of COVID is just one more reason to get vaccinated. The vaccines we have are good coverage for these variants. So let's shift to the news of the week, which is the updated mask guidance. Turning to the recent CDC mask guidance, as the governor mentioned, the mask mandate will be lifted this Friday, and the exceptions are in certain settings, such as taking public transit, like buses or planes, school settings, healthcare settings, and congregate settings like prison facilities and homeless shelters. And while many Delawareans think this is good news, it's really only good news for those who are fully vaccinated. If you're fully vaccinated, you have a significantly reduced risk of catching COVID, but the unvaccinated person next to you does not. And so if you are unvaccinated or not fully vaccinated, you remain at risk for contracting COVID. And here's the thing. You won't be able to tell by looking at the person next to you if they've been vaccinated or not. So even though others may not be wearing a mask, there's no guarantee that they've been vaccinated and that you are safe if you're unvaccinated. So I have to repeat, if you're unvaccinated and unmasked, you are at risk of getting COVID. So if you want to protect yourself, your best option is to get vaccinated if you're eligible. And if you are not, like in the case of younger children, we encourage you to continue to wear a face mask. So I've heard some people say that they plan to continue to wear a mask, just like the governor just mentioned in his daily trip into the Wawa. Some people don't really trust that others around may be vaccinated, or they just want to set a good example for their children who are unable to be vaccinated. So I want to encourage people who choose not to wear a mask to not assume that those who do wear a mask are either against the vaccination or are unvaccinated, and just respect individuals who continue to choose to mask up. We also applaud businesses that have chosen to continue to require masks. They have the authority to do so, and depending on the setting, it may very likely make their customers feel safer. So bottom line, the way we defeat this pandemic is by getting all eligible persons vaccinated. So as the governor said, and I'm going to mention again, go to de.gov/getmyvaccine to find an opportunity close to you if you have not been vaccinated. And it really is up to Delawareans to do the right thing. So I want to shift now to our exciting news that we talked about last week, which is around vaccination of 12 to 15-year-olds. As we talked about last week, the FDA expanded Pfizer's emergency use authorization. I was particularly excited as a mom of a 13-year-old. My daughter and her friends were so excited about getting this vaccine. And so we went to one of the new standalone DPH vaccine clinics at University Park, where upon my daughter's request, the lieutenant governor vaccinated them. And we even did a short video, which is on our de.gov/youth vaccine webpage. And since last week's announcement, providers statewide have vaccinated just over 2,000 children ages 12 to 15. In our clinics, just in the first few days, we did roughly 700. We've had a number of pediatric providers that had just hit the ground running. One example is Rainbow Pediatrics in Sussex County, which did 30 vaccines their first day. The school-based events that have been scheduled saw significant increases in registration once they expanded the age group as well. This is really important because although children in the past have been less likely to get COVID, they're not immune. And in fact, we've seen increasing numbers of cases among 5 to 17-year-olds. So as more people get vaccinated, especially older individuals, young people we're seeing are making up an increasing number of those who get the infection. And so again, just important to vaccinate them. I want to reiterate the studies of the Pfizer vaccine among this age group was just astonishing. It was found to be 100% effective with minimal side effects among this age group. The other thing that CDC announced last week, which was exciting, was that other vaccines can now be given at the same time as this vaccine, which is really important for the pediatric population, where oftentimes kids get more than one vaccine at a time. So we have posted a fact sheet for parents and pediatricians to use on our website, de.gov/youth vaccine. So I encourage you to take a look for more details. Now, let me shift and provide an update on vaccinating individuals who are homebound. Really excited to share some progress that we've made. We've had a list of individuals who are homebound and who wanted to get vaccine at home. We've contacted all those individuals and either provided vaccination for all those in Kent and Sussex County or have left a message. With Newcastle County, we should be finished tomorrow. So really exciting news. I want to give a big shout out to Lisa Henry, our community health director, and her team at DPH for their efforts, and also Newcastle County. An additional shout out to the members of the National Guard who assisted our staff in going to the homes of many individuals. So we continue to support these efforts. If you are unable to leave your house due to a medical condition or disability to get the vaccine, please call our call center, 1-833-643-1715, push option 3, and we will get you vaccinated. And also as a reminder, for individuals who have access and functional needs, if you go to de.gov/COVID vaccine, you can get more information. Finally, on my last slide, I just want to mention the next phase of our public awareness campaign regarding vaccines. We just launched the final piece this weekend. We've started slowly rolling out information first to let people know where they could get a vaccine. And then last week, we rolled out messaging featuring real Delaware doctors like Dr. Joan Coker of ENT and Allergy in Newark, who talks about why vaccines are safe, even though they were developed quickly. And this weekend, we started rolling out what we're calling our Moments campaign. These ads feature real Delawareans who show examples of what we can get back to doing and enjoying once we're vaccinated. So this picture is of two friends having fun at a cookout, something we know many people have missed doing over the last year. So I hope we can all safely get back to the moments we love as more people are vaccinated. And with that, I'll hand it back to you, Governor.
Thank you very much, Dr. Rattay. And so a change in the mask requirements here in the state of Delaware effective May 21st at the end of the week. There are exceptions that people need to be focused on in terms of public buildings, public transit, planes, schools, healthcare facilities, congregate settings, etc. If you're not vaccinated, you should be wearing a mask. And we hope that you will do so because you're protecting yourself and other unvaccinated folks in the community. AJ Shaw has been the point person, as I said at the top, on our vaccination team, and with testing, we're seeing some, again, further reduction in the number of tests with the positive situation across the state with the high level of vaccination. AJ, give us a report on where you think we are.
All right, thank you, Governor. Good afternoon. So we did see probably our most significant drop in testing last week that we've seen for some time, really probably after the post-holidays when we were, almost hitting triple digits every few days, but just above 25,000. So still going to meet the 80,000 goal number that public health kind of set for us back last May, actually. Definitely have capacity. Want to really also thank Newcastle County. The county executive and his team over the last year has staffed over, probably 1,000 different testing functions in Newcastle County to really assist us and let us kind of spread out a little bit more when it was needed. With the reduction, they're going to pack up shop this week, but we are grateful for their partnership and their flexibility over the last year. With that, we still know there's ample testing opportunities out there. You can go to de.gov/get-tested and look for locations in your community, as well as we look to having some expansion opportunities for rapid testing come probably early to midsummer. So then looking at the vaccination world. So again, a few weeks ago, we were talking about events where we're doing, 3,000, 4,000, 5,000 people a day. And now we're excited when we're almost in triple digits. Diane Hainsworth and her team over at the Office of EMS and a number of people with the Guard and Public Health, the Medical Reserve Corps and Del.dot have really changed their strategy. And we're doing smaller events that we talked about the last few weeks. Yesterday, last night they were at Frankfurt Volunteer Fire Company. They did just about 90 individuals. So we know that's not a lot. We know we have the ability to do more, but we're targeting areas within the state that we know have lower than average vaccination rates. And, for every arm we get, it's a step closer we are to getting to our goals. We'll be at Gumboro this evening, Delaware City tomorrow, and then at the Convention Center on the 21st, which is Friday, which is actually in partnership with a hiring fair that they have. And then they have a second dose event coming up this weekend at the Dover DMV, which were for individuals that got their first shot out at the Speedway 3 weeks ago. Again, check out the website. There is a lot of information of other events, not just that the state is doing. We have Curative, we have other partners that are getting out there, as well as check with your school districts. There's a lot of events that are planned in and around for those between the ages of 12 to 17. And we look to having more of those offers as Dana and others at Public Health work very closely with the Department of Education. So check out the website, see what vaccination events are in your neighborhood. Don't forget about the 4 static sites that Dr. Tay just talked about that Lisa and her team now have open Monday through Friday, 8 to 4. People could walk in or they could call the 800 number to make a reservation. Lastly, before I turn it over to the governor, is this is National EMS Week. The phrase this week, which was very it just made sense after what we've seen the last year. This is EMS caring for our communities. And let's just look what we've leaned on our partners for, whether it's been the paramedics that have been at, hundreds of vaccination sites really since December, or when we used, the EMTs just the last few months to help with the administration of vaccine, as well as the curveballs that they've been dealt with along with the healthcare professionals over the last year. So big thank you, I know, from Dr. Tay and myself for everything that we've asked you to do. The guidance, the pages of guidance that we send out and ask you guys to digest in a moment's notice, and make sure that you keep yourself safe, as well as continue to provide great service to the community. So thank you for everything they do. And I'll turn it back over to you, Governor.
Thank you, AJ. That's a great way to end the presentation with a big thank you for our EMS partners. As you said, they've come up big over this past year. Those men and women, boy, I'll tell you, they can put vaccine in you while the car's still moving. They move those DMV lines and the lines there at Dover Speedway like there's you've never seen it before. And of course, our partners in the Army and Air National Guard, we just had a new recruit class come in there, and they're off to a good start. Those men and women have been outstanding. All of your employees in the emergency management area, as well as the Division of Public Health, Health and Social Services, just incredible. Our hospital friends and partners have just come up big over this past year. We are moving into a new stage, as AJ and Dr. Rattay have indicated. We've seen a fall off in the demand for vaccines, and it's easy to get one now. You can just walk up to a firehouse or a clinic in your neighborhood. We're bringing those clinics out. We've got the vans going around in communities to get vaccinated. I tell you, it's a big relief to know that you're protected. You know, even if you get the disease and it's not serious enough to set you back or send you to the hospital, it still could have long-term effects on you. So it's really important that everybody get vaccinated. We are moving into safer months with people moving outside. It's going to be a really good summer, particularly if we can hit that 70% fully vaccinated number by July 4th, which was President Biden's goal. We're going to do our part here in Delaware to get there, but we need your help, particularly those that are unvaccinated. So thank you all for joining us. I know we have press that have joined as well. There's some pre-submitted questions, and we'll open it up to those who are with us on the Zoom call.
Right, first we'll go to Amy Cherry with WDEL.
Hi, everyone. Thanks so much. Governor Carney, wondering as we see more and more restrictions being lifted, when you will consider lifting the COVID-19 state of emergency as a whole?
Yeah, so as soon as we can. I've been saying that all along. There are certain things that require emergency order, and so we have stripped out a lot of those provisions in the most recent update. And so, as I said, as soon as we can, there are certain things that none comes immediately to mind that are in place that need to be. There are issues around eviction and all kinds of things that affect local governments and their ability to do business. They've adapted to that, and we have changed those restrictions throughout the year plus, and nobody will be happier to strip off all those emergency orders than I will.
Okay, and second question, a new Economist YouGov poll shows that those who reject the vaccine also often believe it's safe to go without a mask. I'm wondering if you're at all worried or frustrated by CDC guidance as it relates to only vaccinated people and sort of the quandary that you've addressed a little bit here that it creates.
The nail on the head with respect to the dynamic there, and we are frankly a little frustrated. We've been getting great guidance from them. It's a really good thing that the vaccines really help and protect those that are vaccinated. And we know that, around 50% of our people are vaccinated. We just don't know which 50%. So it becomes a little bit unenforceable in that respect. And I've said all along, leaders without followers, you're just out there taking a walk by yourself. And so we had to use some common sense, really emphasize the importance of getting vaccinated, work with the guidance. We've also said from the beginning, we're going to follow the guidance from CDC, and notwithstanding the fact that this particular guidance has made it very difficult to sort out with some common sense how to enforce it at the local level. I'm confident that most people will do what's recommended, and we know we rely pretty heavily on voluntary compliance anyway. It just has made it a little bit confusing. And by the way, they were clear from the beginning about some of the exceptions in schools, in prisons, in congregate settings, et cetera, et cetera. That didn't get the news, but that's part of their advice as well.
All right, next we'll go to Nick Cialino with Delaware Public Media.
Good afternoon, everyone. Thanks for taking my questions. I noticed in the modification to the emergency order that the distancing rule would still be in effect in a school setting. Is that because some children are too young to get the vaccine? And if that's the case, then in high schools, would there be no distancing rule? And also, did I miss anything? Is there any other setting where the distancing is still a rule?
Dr. Rattay, do you want to take that one?
Yeah, sure. So you are absolutely right about schools. Kids under the age of 12 can't get vaccinated, and we still have a lot of kids 12 and up who still need to get fully vaccinated. Those 12 to 15 won't be fully vaccinated until really the school year is ended. And so we don't expect any changes for the remainder of this school year as it relates to distancing or even mask wearing. But the other guidance in the modification does include a 3 feet spacing, so you can maximize capacity, but still, keeping tables, as an example, 3 feet apart.
And then Governor Carney, any comment on New Jersey's move to keep the mask mandate for indoor settings?
Yeah, Governor Murphy and I did have an extensive conversation about that. He was, frankly, we were both in the same place initially, and then the more I talked to our team about it and thought about it, the more I thought that it would be very, very difficult, if not impossible, to enforce, as well as inconsistent with our pronouncements of following CDC guidelines from the beginning. Notwithstanding the fact that this guidance was somewhat confusing, but yeah, he just felt like, and I think it's a close call, that we're not where we need to be yet, and there can be, and people need to understand this, that there can be an outbreak. I asked this question of Dr. Walensky on our call this morning. There can be an outbreak among the 50% that's not vaccinated and maybe not wearing masks. I mean, that's just the simple reality. And we also know that, as I mentioned in my presentation, that the age cohort that where we've seen a lot of spread, the young adults, 18 to 34 or 5-year-olds, the vaccination rate there is only about 25, 26% last time I looked. And so you've got a significant percentage of that population unvaccinated. At the end of the day, it's, people heard what the CDC said and they figured it's over. Number one, it's not over. And number two, it just became difficult from our perspective to be able to enforce it. And so we're trying to keep the messaging clear that people who aren't vaccinated need to get vaccinated, and use this as motivation to really lean into our efforts to get folks vaccinated. And I think we can make real progress there. Governor Murphy, he decided to keep the mask mandate for a little bit longer, and it'll be interesting to see how they do with the enforcement there and how they do with compliance.
All right, next we'll go to Tim Mastro with Delaware State News.
Hi, everyone. Good afternoon. Governor, you mentioned the challenges with enforcing this most recent change. Is there anything businesses can really do? Should they be asking people if they're vaccinated, or is this just kind of going with the honor system here?
Yeah, I think in terms of our help in enforcing it, it is the honor system. Obviously, they have and can have a mask mandate in their facilities, and I suspect that some will. I mention all the time, I go into the Wawa as many mornings as I can, and I'm always wearing my mask. I was in there this morning, everybody had their masks on. I was in a big retailer last night, and look like they have news signs saying that they're going to require masks. I think it just makes everybody feel, otherwise you got to suss out who's vaccinated and who's not, and that's just impractical. You certainly can't do it when people are coming in to get their coffee and leave. And so yeah, they'll have the flexibility and the authority to do that within their establishments. I hope everybody respects decisions that businessmen make. We're respecting people's privacy with respect to whether they're vaccinated or not. And if we approach it like Delawareans, I think we'll be fine.
And then for the new distancing regulations, how should that affect those who are partially vaccinated or unvaccinated? Maybe someone is a couple weeks removed from their first dose and they want to go out to their favorite restaurant. They're wearing their mask. Should they ask to keep their distance? How does this just affect that group of people?
Yeah, that sounds like a Dr. Rattay question.
Yeah, Tim, it's a great question. So as you know, we've talked about all along, masks are, one of the most important mitigation strategies. So if you are not fully vaccinated, 2 doses plus 2 weeks or J&J plus 2 weeks, then you should consider yourself at risk. Mask wearing is the most important thing you can do. However, distancing also is important. So, you do want to continue to, if you're not fully vaccinated, keep a distance. And still the CDC says, 6 feet is the best distance if you're at risk for getting COVID. And so, there's a lot of, people need to make choices on their own. If they're at risk because they're not vaccinated, then they need to pay attention to not just mask wearing, but also distancing.
Nick, if I can go back to our position as an employer, we're going to require everybody to wear masks for the time being, and the public coming into public spaces, unless you're in your workplace setting and you're appropriately distant from folks, just so that we don't, because we're not going to ask the question, right? And so we don't know who's vaccinated and who doesn't. And so that's how we're going to work through that. And I expect other employers will do the same. It gets more difficult, obviously, in the kind of establishments where you might have people that object to that.
All right, next we'll go to Brandon Holbeck with the News Journal.
Given the state's position with requiring masks still at your facilities, is it fair to say that had the CDC not come out with this guidance, you would feel more comfortable continuing with the mask wearing mandate we previously had?
Yeah, I think it's a great question too. I think we're coming up to a place where our data themselves, this is one of the reasons that gives me some level of comfort to make the decision that we made, as opposed to, doing as my colleague across the river, Governor Murphy, decided to do. You saw earlier, we're down to 120 positive cases on 7-day moving average. We're well under 5%. We're well under 100 hospitalizations. And so we know the spread has gone down in our state. We know that half our population is vaccinated and they're not going to be as at great risk. My obligation, though, is to both 50%, right? The 50% are vaccinated and the 50% who aren't vaccinated. And so that's why there's a note of caution on this. But the data being in the downward trajectory as it was gave me a level of comfort that say we can go in this direction. But by the way, the question remains, what happens if the roller coaster goes up the incline again and we start peaking and having an outbreak? The most effective way of preventing that is to mask up for those who aren't vaccinated. What CDC will say is that's not a risk for the vaccinated population. Should be a tremendous incentive for those who aren't vaccinated to take that step. Easy to do now. You can do a walk up at your local fire hall and other places. You can get de.gov /get my vaccine or call that number on the screen.
And my second question, Governor and Dr. Rattay, you both spoke about this a little bit, but what would be your message to how parents of children who haven't yet had the opportunity to be vaccinated and might be concerned about their children being in settings where unvaccinated people are unmasked? What would be your message to them and the conduct they should follow over the next couple of weeks and perhaps months?
Dr. Rattay, the pediatrician here.
Yep. For those who are not fully vaccinated, really of any age, but children who can't get vaccinated, so under 12, unfortunately, the mask wearing and social distancing is going to need to be, it's the safest approach. And so, we continue, therefore, to recommend for those under age 12 to wear a mask when they're in public, to social distance from other individuals. And, like we've been talking about all along, outdoors is safer than indoors, and avoiding crowds is, safer than being in the middle of a crowd, especially now that there will be, a number of individuals who aren't wearing masks. So I do feel kind of sorry for those who are under age 12, because they still have a ways to go before they're going to be able to get vaccinated and enjoy some of the benefits of vaccination that many others are. But really, that is the safest recommendation at this point.
All right, next we'll move to our pre-submitted questions. The first question is from Dan Laurelham at Delaware Live. He asked, Governor, do you have any intention of refusing federal unemployment increases set to run out in September? Do you plan to reinstate the unemployment policy that says people must be looking for a job to receive benefits?
Yes, we do plan on putting back in place requirements that individuals that are receiving unemployment benefits look for work. There was a series of things that they have to do: get the resume out there, pursue certain opportunities, or demonstrate that they have pursued certain opportunities. We know that there are hundreds, probably thousands of job vacancies out there. I hear it from employers across the spectrum. And so folks need to take that step and start looking for jobs. And that will be part of the back. We will take, that is the normal requirement. It was suspended for some period of time by the feds and by the state, but we will put that back in effect. I don't think at the moment we're thinking about not utilizing federal unemployment benefits, but the requirement that people look for a job will go back into effect.
Our next question's from Betsy Price at Delaware Live. Are there any plans to give people who were fully vaccinated another booster shot? The people who were vaccinated in December are right on top of being 6 months out. And at one point there was talk about having another round of booster shots at that time period.
Dr. Rattay?
Yeah, so, we are, eager to see how the science evolves in around the situation of whether boosters are necessary and when they are necessary. At this point, there is no recommendation for booster shots for anyone, but that may change in the future.
All right, this is the last question. It's from Chris Barish at WHYY. It was covered a little bit earlier, but Governor, do you expect the unvaccinated to follow the updated regulations without enforcement? Do you have any message for them beyond just to get vaccinated and follow the rules? We also had a similar question from George Shea at Delaware Newsline. Does it concern you that those who are not vaccinated will go into establishments and put others at risk?
Yeah, it does concern me that some that are not vaccinated will not wear a mask when they're in public and put others at risk. I guess there's good and bad of that. They're not putting people that are fully vaccinated at risk, but they're putting other folks that are not vaccinated at risk. My concern as governors for both the vaccinated and the unvaccinated. And so my message for those who have been vaccinated is, thank God you've taken that step. You're protecting yourself and others in our community. And for those who are not vaccinated, now's the time. Get vaccinated. You're going to protect yourself. You're going to protect your family members, your friends. You're not going to be putting people at risk. You're not going to be putting our economy at risk. And if we have another surge, we saw that roller coaster ride. We don't want to see another increase in the number of cases. We actually don't know what's likely to happen there with 50% of people vaccinated, but you can envision a world where the people who are unvaccinated pass the virus around among each other and end up getting sick in the hospital and some passing away. But it's a simple message. It's the same message that we've had from the beginning, which is pull together, do the right thing, get vaccinated. It's an easy thing to do now, de.gov/getmyvaccine, or you can call the number 833-643-1715 and get vaccinated. Once we get to 70%, we'll feel a lot more comfortable. We're already in a good place with positive cases on the downward trend, hospitalizations under 100 and moving down daily, and deaths have really flattened out. We're protected significantly with the 65 and older population, with 90% having received one vaccine. So let's have everybody do the same and pull together, and we'll get into a much better place. Other questions, or was that the last one?
That was the last one.
Very good. Okay, so thank you everybody for joining us. Thanks again to Dr. Rattay and AJ Shaw, Director Shaw, and their teams of Public Health and Emergency Management, all of our partners. Thank you to Pam. Remember to sign up for your vaccine. If you haven't been vaccinated, the CDC tells us that if you're fully vaccinated, you may not be bulletproof, but you're almost bulletproof, and you'll protect yourselves, your family members, and everybody else, and make it easier on all of us so we don't have to sort out who should be wearing a mask and who shouldn't. Thanks for joining us today.